Can you give me an example of perhaps a experience that you were part of in field research where you really just got a deep appreciation for what a patient, let's say, was going through, and how perhaps the treatment itself or the skills of the team that was treating that patient were so inexorably linked to their experience and probably in how outcomes might have even transcended the procedure themselves?
Yeah, that's a good question. One does come to mind. We're working on a device within the ecosystem of something called Mohs surgery. And so Mohs surgery is essentially a type of surgery that's done often in outpatient clinics. It's like a day surgery. You just kind of come in, almost like getting a dental procedure, but way more complex than that, done by very top-tier plastic surgeons. And basically what they were doing on this particular day is they were excising cancerous tissue. So we're talking about like basal or squamous cancers, less dangerous but still problematic for people. And it started the day with patient comes in and the doc is just using their sort of skin-friendly marker, and they were marking all over the patient, all kinds of little dotted lines everywhere. And I thought, oh wow, that seems like there's going to be a lot of cutting that's going to happen there. And so they bring the patient in and they start cutting pieces out of the patient's face, literally like removing large chunks of their face. And as a researcher who's working on a system that wasn't necessarily directly related to that excision, but I just thought, oh my God, like that person is going to be disfigured for the rest of their life. Like that is crazy what I'm experiencing here. This is a life-changing event for them. And then we go through the process of like taking it into pathology, because they do a lot of that pathology in-house. That's one of the magic of Mohs, is that you go through this iteration of excision, pathology, look for margins, come back in, excision, pathology, margins, until you get to the place where you just got that healthy margin, you got it all out. And so, and then they would basically just bandage them up, send them out to the waiting room, and they'd all just be sitting there with like a bunch of folks who have had half their faces cut off, and they're just kind of in the same room. And I thought, wow, there's this sort of dignity component to that, which is a bit crazy to me. And I thought, like, if that patient saw what she looked like, what would she think of that? Or, there's no mirrors or anything like that. Like, this is all sort of thought through. But anyhow, so they get them back in at the end of the day, and then they start sort of repairing them and stitching things back together. And I thought, oh my God, like, look at her face. It's amazing. She's going to be probably fine. Obviously it looked like she'd had surgery that day, but, and it sort of made me realize, this is kind of cool to be a part of this whole, like, the thing we're working on is kind of part of this process to simplify this and really kind of bring a little bit more value and efficiency to an otherwise pretty challenging and difficult situation for both the patient and the user.
Yeah,
too.
you can imagine the alternative, right, would be great clinical outcome, but a total fail from the patient's perspective, right?
Exactly. And quite often, you watch some of those old movies with I don't remember which movie it was, but there was some child who was getting like a gamma knife treatment, and it was this long, scary looking thing, sterile room, really cold lighting, 6,000K lighting, and I thought, could you just scare that child anymore who has cancer? Like, I think that this is where, pull that back for a moment, let's peel that back and bring some value to this. And to be honest, this often converts and translates into more market adoption and more money for our clients, more revenue, more sales. It's amazing. This is not something that's just, locked into consumer products. It has a huge place in medical device development.